If your child is depressed, there may be more to worry about than you think. Earlier, I spoke with Dr. Tim Malins about a new study that shows depression in kids can cause almost the same symptoms as in adults. Tonight, we're focusing on childhood depression and the link to cardiac disease. And joining me now is Dr. Tim Malins with Rochester General Hospital, a cardiologist there. Welcome. It's fairly well established that depression in adults has a major impact on one's physical health. You're saying that the same is true for children.
That's true. So we do see in adults that increased depression, anxiety does lead to more heart attacks, earlier death. And there was a recent study that looked at this and it said, how far back does this go? Is it really in adults, or do we see this potentially in children that could affect their life expectancy?
Yeah. And what did they find?
So they looked at depressed younger kids, so starting some even at age 9, and they had found out that those that were depressed and treated, even those that were treated, but just the depression itself was the risk factor. And the reason it was the risk factor was because these children were far more likely to end up smoking in follow-up in their teens very early on, be more obese, and have a much more sedentary lifestyle.
And all of those factors contribute to poor health, for sure.
That's exactly right. And the most concerning is that we see these children that were potentially smokers and potentially going to be obese and less active had almost twice the risk of dying before the age of 55 than their counterparts.
So I guess the takeaway here would be to keep a close eye on a child who is depressed, not just in terms of their mental health, but their physical health as well. What should you be looking out for?
Well, I think that's a great point. What you want to look at is understand that these are the things that are going to lead to a potentially shorter lifespan. So one, identifying the depression and treating it.
Right.
Two is, if they're smoking, really work to get them off smoking, keep them away. If you're a parent and you're a smoker, one of the biggest correlates between a child smoking is that his parents smoke. So that should be a trigger that you quit. Get them more active and have a much more healthy diet. Don't have the ding-dongs and Twinkies and processed meats, and do it as more of a family type issue, because the benefits that you do now is like putting money in the bank because they can live longer.
The research certainly shows it. Okay.
That's right.
Dr. Tim Malins, thank you very much.
Thanks, Lori.
And to see more Your Heart and You segments, head to rochesterhomepage.net and click on the News tab. There is an easy step women can take to help in their recovery from cardiac disease. Earlier, I talked with Dr. Tim Malins about a new study on that topic. It's in this week's Your Heart and You.